So now let's talk about the nerve injuries. So in nerve injury, there is a neuropraxia, axonematis, metosis, and neurotmesis. Neurotmesis is complete transaction of nerve. This is the radial nerve, and if it's completely transected, it is neurotmesis. Neurotmesis is very difficult to heal. You need nerve transfer plastic surgeon. Okay, neuropraxia heals in 6 weeks. Okay, it is like dhakka lagna only. Okay, jhatka lagna is neuropraxia. Okay, axonematis is more severe than neuropraxia, and neurotmesis is severest form of nerve injury. Okay, now the Tinel sign. Tinel sign we used to detect the progression of nerve regeneration. Okay, now the first is median nerve. So what is the action of median nerve? So median nerve supply all the flexors of forearm. मीडियन नर्व को क्या है, भगवान ने जब बना रहे थे तो उन्होंने क्या बोला, मीडियन नर्व को सारा काम दे दिया कि तुम फोरआर्म का काम संभालो. ओके, एंड अल्नर नर्व को बोल दिया तुम सारा हैंड का काम संभालो. ओके, बट इट इज मेडिकल साइंस, इट इज नॉट दैट इजी कि सब कुछ मीडियन नर्व सप्लाइड बाय द, इतना सिंपल होता मेडिकल साइंस तो सबको ही कर लेता फिर. ओके, तो बट देयर आर सम एक्सेप्शन, लाइक लेट्स you have to understand some logic so you can remember all the nerve supply of flexors, all the nerve supply of muscle. Okay, so median nerve क्या होता है, median nerve is going laterally in forearm. Okay, and ulnar nerve is going medially. So how will you remember the ulnar nerve is going medially? So you can, whenever someone strikes this elbow, this medial condyle in whenever someone strikes medial condyle, ulnar nerve is going below the medial condyle. So he has sensation, that is the ulnar nerve. So you have remembered that ulnar nerve is going medially, so obviously median nerve is going laterally. Okay, so median nerve lateral से जाती है और ulnar nerve क्या है, medial से जा रही है. Now they are forwarding in the forearm then hand. So in forearm I have told you median nerve को forearm का पूरा काम दिया हुआ है. भगवान ने जब नर्व्स बनाई तो मीडियन नर्व को पूरा forearm का काम दे दिया. ओके, एंड अल्नर नर्व को पूरा हैंड का काम दिया है. ठीक है, तो मीडियन नर्व सप्लाई ऑल द फ्लेक्सर्स. देयर आर 12 फ्लेक्सर्स इन फोरआर्म, ऑल द फ्लेक्सर्स एक्सेप्ट कौन, एक्सेप्ट फ्लेक्सर कार्पाई अल्नारिस. नाम में ही लिखा है अल्नारिस, नेम इन इटसेल्फ रिटन एज फ्लेक्सर कार्पाई अल्नारिस. सो अल्नारिस because it is written as ulnar, so you can remember that it is supplied by ulnar nerve. Okay, and medial half of flexor digitorum profundus. So flexor digitorum profundus is a deep muscle in flexor compartment. So deep muscle has lateral half is supplied by median nerve and medial half is supplied by ulnar nerve. Okay, because उसके बीच में आ रही थी, ulnar nerve is progressing in forearm and the flexor digitorum profundus medial part is coming in between, so it is supplied by ulnar nerve. Okay, now the median nerve is going in hand. So median nerve is going in hand. So here are thenar muscles. So he supply muscle except all the thenar muscle except adductor pollicis. Adductor pollicis is supplied by ulnar nerve. Okay, now it is again going forward. So it is supplied by thenar muscle is supplied by median nerve. Okay, now first and second lumbrical, there are 4 lumbricals. So first and second lumbrical is supplied by median nerve and third and fourth is coming in way between of ulnar nerve. So third and fourth is supplied by ulnar nerve. Okay, now we have one more branch of median nerve, that is anterior intraosseous nerve. So anterior intraosseous nerve, because when God is making humans, so median nerve को बहुत ज्यादा काम हो गया, so he made anterior intraosseous nerve. It is a branch of median nerve and God said to him that you have to just go deep, you have to supply deep compartment of flexors. So he supplied flexor pollicis longus. Okay, and flexor profundus, flexor digitorum profundus lateral aspect. Okay, so we have learned about the nerve supply of median nerve. Now Chloe-Levin sign, it is weak okay sign, it is seen in anterior intraosseous nerve palsy. You can see this patient. Normal patient can form O, but abnormal patient will not form O. Why? It is seen in anterior intraosseous nerve palsy. If you ask in which nerve palsy, you will see, if you say specific, then it is anterior intraosseous nerve palsy, and if you say generalized, then you can say median nerve. Okay, why it is seen in anterior intraosseous nerve palsy? So anterior intraosseous nerve is supplying flexor pollicis longus and flexor digitorum profundus lateral aspect. So flexor pollicis longus is paralyzed now because anterior osseous nerve injured, so there is no any flexion of thumb, and flexor digitorum profundus helps in flexion of distal phalanx because it is inserted at the distal phalanx. So there is no any flexion at DIP joint, distal interphalangeal joint. So these two movement is help in formation of O. So because anterior and anterosseous supply both these muscles, so because of this paralysis of injury of anterior and anterosseous nerve, the patient will not able to form O. So tell me in which fracture anterior anterosseous nerve is most commonly injured? That is supracondylar humerus fracture. Okay. Now there are various tests to detect whether it is median nerve injury or not. So first is pen test. What is pen test? Patient is asked to touch the pen. Okay. So patient is not able to touch this pen. Okay. Why? Because there are three muscles in the thenar muscles: abductor pollicis brevis, flexor pollicis brevis, and opponensis pollicis. So this is abduction. So because this patient is not able to do abduction because of median nerve injury, so pen test is positive. Next is Ochsner-Clef's sign. So ask patient to form this fist, and the thumb, his middle finger will be like this. So what is the cause? Because flexor digitorum profundus of first and second FDP is supplied by branch of median nerve, that is anterior anterosseous nerve. So because if median nerve is paralyzed, median nerve is injured, so patient is not able to flex the DIP joint. So his finger will be like this. Okay. Next is pointing index sign. So because patient is not able to flex first and second finger because FDP is paralyzed, and FDP action is to flex the DIP joint. Flexor digitorum profundus is inserted at DIP level, and action of the flexor digitorum profundus is to flex the DIP joint. So patient not able to flex the DIP. So in median nerve injury there is a Benedict sign. Fourth is ape hand deformity. So what is ape hand deformity? Patient is not able to do abduction, and the thumb will be like this because adductor pollicis brevis action is lost, or you can say adductor pollicis action is increased. So it is like the ape hand deformity. Okay. So do you understand the test and the why there is Benedict sign, why there is pincer grips? So and why it is pincer grips? So you can see this is normal, this is pincer grips. So I have explained you in also Cleven-Levin sign, that is same as pincer grips. Okay. Now next is ulnar nerve. So because median nerve is supplying all the flexors, most of the flexor, so it is known as lever nerve. Lever का काम करती है. Ulnar nerve is known as musician nerve. And one more thing, median nerve is supplying 3.5 fingers in sensory portion. Okay. And nail beds, 3.5 fingers in palmar aspect, and nail beds in dorsal aspect. Okay. Now the ulnar nerve is supplying flexor carpi ulnaris in forearm and flexor digitorum profundus medial aspect in forearm. Now it is forwarding in hand. So it is supplying all the hypothenar muscles in hand, third and fourth lumbricals, palmar and dorsal introssei. Okay. Now and also 1.5 fingers in sensory supply because 3.5 is supplied by the median nerve. Okay. Now let's assume the test. What is test? Various tests in. So to understand the ulnar nerve injury, there are various tests. First is book test. So patient is asked to hold the book, but his thumb is flexed because of action of flexor pollicis brevis, which is supplied by median nerve, and adductor pollicis action is lost. Adduction of thumb is lost. So it is known as Froment sign also. And this is book test. Okay. Next is card test. So card test is used to know the function of introssei. So patient is not able to hold the card in between because of loss of action of palmar and dorsal introssei, which causes adduction as well as abduction. Okay. Next is Igawa test. So patient is not able to move the middle finger, abduct or adduct. This is known as Igawa test. Froment sign I have already explained. Now there is a concept that lower ulnar nerve injury causes more clawing than the upper high ulnar nerve injury. Why? Because in high ulnar nerve injury, there is paralysis of FDP as well as intrinsic muscle. So because it is causing the paralysis of FDP as well as intrinsic muscle, so FDP will not able to flex the DIP joint. So there is less clawing. But in case of lower ulnar nerve injury, FDP is supplied already. lower ulnar nerve injury is injury at the level of wrist. Okay, so till the level of wrist, FDP is supplied already, FDP medial aspect, so it goes the flexion. Okay, and the claw hand formed due to hyperextension at MCP joint, because lumbrical section is lost. Lumbricals cause the flexion at MCP joint. So because lumbrical action is lost, so patient will have hyperextended MCP. Okay, so that's why the patient will have clawing. That's why it is partial claw hand. Okay, the patient will and for the this patient we will use knuckle vandal splint. Next is radial nerve. So radial nerve is supply the all extensor of forearm. There in palmar aspect, in volar aspect, there are two nerve. First is median nerve and ulnar nerve. But in case of extensors, there is only one nerve, that is radial nerve. Okay. So radial nerve supply the all extensors and its branch PIN, posterior and process nerve, it supply the thumb and fingers. So very high radial nerve injury is at the level of shoulder joint, at the level of axilla. So patient will not able to extend the elbow because all the extensors are paralyzed, because injury is at this level. Now the injury at high radial nerve injury. So high radial nerve injury, patient will present with shaft humerus fracture and radial nerve. So in this case, triceps is supplied, so elbow extension is present. Okay, but thumb drop, finger drop, wrist drop, sensory loss, because all the muscle supplied in forearm is lost, so it causes injury. Now, because ECRL, extensor carpi radialis longus, is causing the wrist extension. Okay, so if there is injury proximal to the ECRL, so if the injury at the level of proximal to the ECRL is originate from the lateral epicondyle. Okay, so if there is injury at the this level, distal 1/3 humerus, then it causes wrist drop. If the injury of radial nerve is in forearm, then wrist drop is absent. That's why in PIN nerve injury, wrist drop is absent, because ECRL is supplied by radial nerve. So there is no any wrist drop in PIN injury. Okay. In PIN is supplying finger extensor, thumb extensor. So PIN injury leads to finger drop and thumb drop. So radial nerve injury at the level of humerus will present with wrist drop. PIN injury will present with thumb drop and finger drop. So in this case, how will you treat? You will apply Cockab splint. If there is neuropexia, it will go in 6 to 8 weeks. Now the compression neuropathy. Carpal tunnel syndrome. Carpal tunnel syndrome is median nerve compression. Median nerve compression at this level. It is caused due to various reasons. Due to distal radius, malunion distal radius fracture, and there are so many reasons. Hypothyroidism patient. So it causes burning and tingling and numbness, paresthesia in middle of night. It is female is mostly affected. Fallon test is used. Patient is asked to do this. Okay, patient is asked to do this. This is Fallon test. Okay. Durkin test also done for carpal tunnel, direct median nerve compression. Investigation of choice is nerve conduction velocity, meralgia paresthetica, entrapment of lateral cutaneous nerve in thigh, pyriformis syndrome, entrapment of sciatic nerve, tarsal tunnel syndrome, entrapment of posterior tibial nerve. So these all are the compressive neuropathy. Nerves are compressed at these levels. Erb's palsy, policeman tip deformity, waiter tip. At C5 and C6 is affected. These we have read in anatomy. Klumske palsy, C8 and T1 is affected. Claw hand, wrist extended, Horner syndrome. Okay, cubital tunnel is in ulnar nerve is in cubital tunnel, and ulnar nerve is also in Guy's canal. These are present at the level of wrist. Okay.